it's March 31st, 2020. Dr. Noel Williams, Optimal Health Associates, Oklahoma City, Oklahoma. I'm going to do my COVID update. Right to my left is Titan, our pug. He may make a little bit of noise, but I'll ignore him. He's really just a sausage with feet. He's not really a dog. But anyway, kind of the concept tonight comes from the movie A Few Good Men, and when Jack Nicholson says, "No, I can't handle the truth. You can't handle the truth." That's why my wife's here. You can't handle the truth. That's not true. We can handle the truth, but we've not been given the truth. So that's what we're going to focus on. There's currently 810,000, 815,000 COVID infected people total so far in the world. There's over 40,000 deaths roughly. In the United States, we're at about 180,000. Unbelievable amount of cases in just 2 weeks. Right out of Liz Sprite's predictions, with almost 4,000 dead. Unfortunately, that number is just going to be skyrocketing now, and it's important to know why. Why did this happen? And that's what I want us to focus on, because I want all of you to remember. I will do my part when this is over, if I get through it, which I hope I will, and I hope all of us do. But if I don't, I want people to do something, okay? And it's to address all the lies that we're told. And it's important. So Trump said today they couldn't really have reacted earlier or known that it was going to get this bad, or it was this infectious, or a whole litany of things that were untrue. Dr. Fauci, who I use the word doctor very loosely with him, I think we should call him a politician, basically communicated the same thing. They never would have thought it was going to be like this, and thus and so. And so, you know, we should be pleased in many respects that we're only going to lose 250,000 people. But keep in mind, Dr. Birx yesterday said we'd lose 200,000 people if we handled it perfectly, but it could go to 1.2 million. So none of that's good news. But let's kind of analyze it a little bit so you'll remember this. So I'm a gynecologist. I have a huge practice. Those of you who know me, I have 6 providers who work for me. One's out, Abby Crail, with her baby Caroline, which is wonderful because she's been out of the loop to an extent on this. But in January, when this all began, there's 5 providers and me. We're seeing 150 plus patients a day, plus doing surgery a couple days a week. And we're busy. But by mid-January, I figured out that there was something going on with the Wuhan virus, or whatever you want to call it, COVID-19, but the original infection in Wuhan. And I have a public health background, and so it was interesting to me, and I started paying attention to it. And by the 20th, I became very concerned about what was going on. So mid-January, 10th, 12th, moving forward, I really started paying attention. And by the 22nd, I was fairly terrified because of Chinese New Year and all the traveling. And some of that comes from life experience, and my family had lived in Hong Kong, and knowing how Chinese people travel at certain times of the year, that it was a big deal to have all that traveling. And so when China closed down the traveling in Wuhan on the 23rd, I thought, we're in big trouble, because they'd let 5 million people leave Wuhan between the 17th and the 23rd. And so if they now suddenly are closing Wuhan down and they're escalating all this stuff, this is a much bigger deal. And then data started coming out. And so by February 1st, I was very, very concerned. And the thing I noticed at that point that really was hitting home was that the CDC and the infectious disease, allergy and infectious disease division of the NIH, which Dr. Fauci runs, and the CDC, which Robert Redfield runs, weren't really doing anything at all. I mean, not really focusing on it at all. Had said they were going to start on a vaccine, but it was no big deal. It wasn't that infectious. It was not going to be a pandemic. Now that was Dr. Fauci. Now Dr. Redfield, by about the 7th or so of February, said he was very concerned it could be a pandemic. But by the 10th, Dr. Fauci was very, very adamant it was not going to be, because I did my first video on the 9th, so I was following it now very closely. And at that point, it became even clearer to me that they were being disingenuous. And I thought at first they were being disingenuous which is an old public health policy type thing, to calm the public while they're getting their stuff together, which wasn't what was happening. They were calming the public, but they weren't getting their stuff together, and they weren't paying any attention to this. And then by mid-February, when the data was really starting to show that, unlike what President Trump said today, that COVID, we didn't know it was that infectious, the data was very, very black and white, absolutely clear. We knew about the protein spike change and the mutations. We knew that stuff, that it was between 100 and 1,000 times more effective than SARS. Minimally more effective than SARS. And we didn't react, and we didn't do anything. And then by late in February, when it was abundantly clear this was a world crisis, we still were not doing anything. And sometime around that point, or a little later, the U.S. Surgeon General said, masks don't matter, you don't need to wear masks. Masks would make you worse. Completely idiotic and bankrupt intellectually, because masks are a key strategy for preventing spread, which I talked about last night. So if we look over the last 2.5 months, the federal government has had ample opportunity to address this, and then they've persistently tried to cover up their errors with comments that are completely disingenuous. And it's important to know that. So now that they're finally saying, kind of, OMG, we're going to have 250,000 Americans die, and we should really be more positive about this, and it's going to be an awful 2 weeks, you have to still not believe them when they say it's going to be an awful 2 weeks. It's going to be minimally an awful 4 weeks, and that doesn't even make sense, because one of the smartest people in the United States, Bill Gates, said it wasn't even going to peak till the end of April. So if we follow what, again, Bill Gates projected, and keeping in mind he's brilliant and has as much computational power at his fingertips as anyone on the planet, it comes up for 4 weeks, it's going to go down for 4 weeks. It's kind of a nice bell-shaped curve. It may be a little more pointy. But again, Liz Sprite, the PhD, predicts it won't peak till the first week of June, and all her numbers everything that's going on has followed exactly what she said. So it may be rising over the next 2 weeks and keep on rising through June, which will be a total disaster in terms of the death rate, but we'll just have to see. I've said last night, I'm going to split the difference and say it's going to rise through mid-May, because that's kind of the halfway point for them. And they seem to be the two smartest people looking at the modeling for when it's going to happen. The longer the peak goes in terms of further out, the better, because if we have a peak later, that gives more time for people to be sick and get better before it really goes up high. That's the first thing. The second thing is, if the peak's later, globally in the United States or holistically in the United States, there'll be a larger amount of people who got the virus. And that also means when the next wave comes in the winter, there'll be less people available for infection, so the second wave could be much better. If the peak is earlier, we're not going to have as much infection now, and then we'll have a bigger wave later. So it's just things to keep in the back of your mind, and always remember with the Spanish flu, there was a third wave, which also makes sense for this because it is unlikely we're going to have a vaccine for at least 12 and up to 18 months. So we have to be prepared for the next 8 weeks to 16 to 20 weeks to be very difficult on all of us, on our loved ones, our friends, and be supportive to them. I would be very suspicious of the things that are coming out of the federal government in terms of data, because they consistently do not present the real data, whether it's on how infectious it was, whether it was going to be a pandemic or an epidemic. The closure of the borders really was too little too late, and not closing the European border several weeks before was completely completely a fail, but I mean, I don't blame anyone for that, but that's why you get paid to do this stuff. When you're an infectious disease expert for the United States, you have to help the government make the right decisions and not be saying the whole time that it's not going to be a pandemic. The masks, the saying Plaquenil was terrible at first and belittling all the doctors who figured it out and started trying to get patients to be aware of it, not addressing any preventive strategies with zinc or melatonin. I mean, everything that we're doing, we're lagging 2 to 4 weeks after the data comes out, maybe even 6. And so as a country, that's painful. The good news is, and we want to finish on a high note, most doctors who are in this loop of caring, I'm a theorist and looking at all this in terms of data, they're living it, who are taking care of you, and they're like me. But they're looking at the data like, what's the best treatment strategies? And so that's our gift, is these physicians, these nurses, these respiratory therapists, and then some of the hospital administrators in the United States who are supporting them, which I'm going to come back to. But these same intellectually curious people are going to be there to save the vast majority of the Americans who get COVID-19, because they've come up with cool things to split the ventilators. They're looking at all these different medicines and using them in a different way to support people, like TPA and Plaquenil, and then some HIV drugs and some other antivirals to really do cutting edge practice before even the FDA gives a direction, which is a godsend, that there's these wonderful, wonderful caregivers. And we really need to be kind to them and nice to them, because they're not all getting positive strokes. Several have been fired and terminated for saying that their hospital was not providing appropriate protective gear. Several have been put in hard places because they stuck to their hospital administrations on care plans and doing the right thing. So we need to be very nice to them. If you look at Spain, approximately 15% of their infected, I think it's about 12,000 of them, are first-line caregivers, doctors, nurses, and respiratory therapists, and a substantial number of those people are going to die. And so we really need to be respectful to the caregivers who are on the first line and are going to be taking care of all of us. I mean, I volunteered, but so far they don't need a gynecologist, which I totally understand, and maybe at some point in Integris they will, and I'll be able to help out in some very minor cog-like way somewhere. But it won't be doing anything except to help free up real doctors to do real care. So, but we have plenty of those people here in Oklahoma City. We have great leadership with Tim Pearson, Carl Ruskowski, Chris Hamas, Tommy Abraham. The people I know at Integris are on it. The leadership teams at all the hospitals, though, are completely focused and ready to go. And again, David Chansom in the Integris system, Dr. Harkis at Mercy system, who's an infectious disease doctor. These people are just working as hard as any group of humans can, and have put their usual practices to the side to completely focus on all of our well-being. So let's give them a big hand and say a prayer for all of them, because without them, we'd never get through this. So it's going to be a tough few months, but we have the people. We have, thankfully, in Oklahoma City, great hospitals, great ventilator support, everything we need. So thank you very much, and good night.